When it comes to burnout, sometimes you lose your eagerness to work, feeling hopelessness, and you become less productive.
The important thing there is the person should be aware of it and says, I need some time out.
Remember the first day in class or the first time you landed a job? These things could excite most of us. However, with never-ending tasks to accomplish, there's a possibility that after a while, you feel burnt out. It's important to understand the red flags before things get out of hand. I'm Dr. Freddy Gomez, and join us as we learn more about the causes of burnout, what to do if you're feeling it, and how to get that spark back. Welcome to Med Talk, Health Talk. By definition, burnout is a state of emotional, physical, and mental exhaustion brought about by excessive and prolonged stress. To tell us more about this, with us today is Dr. Maria Paz Manaligod, who is a developmental psychologist with a PhD in Child and Family Studies from Miriam College. Also with us is Dr. DJ Gabriel, who is an occupational medicine specialist from the Employee Health Services Department of Asian Hospital and Medical Center. Hello and welcome to Med Talk, Health Talk. We touched a little bit on the definition of burnt out. Tell us more about this.
It's prolonged stress. And when we look into burnout, it includes fatigue. I would compare this to a candle. You're slowly losing the energy, and basically it's because of too much stress that has been there for so long.
Dr. DJ, what Ms. Paz was mentioning about are more physical manifestations maybe of burnout, but is there more to it than that?
Yes, when it comes to the work, sometimes you lose your eagerness to work. Negativism, it's like feeling hopelessness, and you become less productive.
Now that feeling of hopelessness, wala nang gana magtrabaho, could this also be confused with depression?
It could be, because sometimes burnout, like you find happiness in your work, you're eager to go to work, then suddenly, it's Monday again, I don't want to go to work, right? So depression might be a factor in burnout. A lot of negativity, like has been mentioned, you don't find that the usual joy that you had, eagerness for work, and also you may be look forward to being absent, being late. So these are some of the symptoms there.
Dr. Paz mentioned some symptoms of burnout, Dr. DJ, but is it this cut and dry? Or are there subtle symptoms that someone is already going into burnout where we can pinpoint it para maagapan?
It's very hard to distinguish, but what's more peculiar with this burnout, it's peculiar to workforce. It's more of the labor force, ang workforce na nagsasabi siya, ay, na-burnout ako eh. Especially this COVID pandemic, natatamaan talaga, lalo na ang mga nasa sector natin ng health.
Dr. DJ, that's very interesting. If it is work-related, one might immediately think that person who is being burnt out is not up to task with the work that is required of them. Is it possible to be burnt out even if you're capable of doing that work? It's just like, this monotonous grind every day. Can that lead to burnout?
Yes, especially if it's monotonous, na dragging yourself into work, then you don't have any support. Yan yung mga things na nakaka-burnout sa'yo. Like, if you see yourself, what you're doing, walang end.
What can happen if it is not addressed? If this feeling of burnout is not addressed by the person, pwede ba itong magtagal? Can this overflow to other factors in their life aside from work?
So like it was mentioned also, they can get depressed. They can isolate themselves from other people. It's all negative. No, I don't like to be here. They get irritable. And of course, this can affect their relationships, how they work. No? So they might not be as functional as they were before.
Can it be a phase? It's common for people to, just not want to be at the present job that they're at, but is it safe to say, that's just a phase? Or should we really address it already, that it's already signs of burnout?
It has to be addressed, no? But we can always go back. I like to believe we're resilient. The important thing there is the person should be aware of it and says, I need some time out, I need a break. And the support, of course, of significant people.
When it comes to burnout, Dr. DJ, we see it happening, unfortunately, with the younger and younger generation. Normally, like what you said, burnout is a workplace phenomenon, but we see it now with the younger children. Why do you think that is so?
Especially now, it's very techy, and very pressured ng mga bata. Especially sa school, they're burdened with lots of homeworks and aside from that, peer pressure, society, yung social media, compounds talaga sa kanila. That's why parang feeling nila nale-left out sila. And sa ngayon, hindi nakakausap yung parents, minsan hindi natin nakakausap yung mga bata natin, yun, they feel left out, wala mapagsabihan, like what Miss Paz said, yan ang talagang nagkukos ng burnout.
So multifactorial siya, no? There's many factors that could contribute to this. Since we're talking about the younger generation now, especially like a parent who have kids in probably high school or college, how can we differentiate that the child is undergoing burnout versus just regular teenage angst? It's that growing up phase that children have.
Yeah, so especially for teenagers, no, they're going through a lot of physical changes, emotional changes, mental changes. When we're looking into burnout, some of those things again is they're not enjoying things that they used to do, going out with friends. A parent might notice this, no? They don't find joy in perhaps eating, playing, no? As compared to angst that you say, it would be more connected to more of a general anxiety, more of looking at the world, complaining, no? But with burnout, it's just more than just complaining. It affects the way they study, the way they work, the way they do things.
Is an obvious sign that their child is probably having burnout would be their performance in school?
Yeah, that would be one of those signs, academic burnout, because of course, they are students. It could be a decrease in their grades, and then even teachers might say, you used to be excited with this subject. You're a good student. What has happened? So those would be some of the signs there for academic burnout.
We've been talking about academic burnout, but later on in the show, we'll talk about how burnout in the workplace can actually affect your health. So stay with us here on Med Talk, Health Talk. After long days of work and high levels of stress, many of us may feel burnt out. It can have a lot of serious physical as well as mental repercussions on this. Now, let's welcome back Dr. Maria Paz Manalico, developmental psychologist, and Dr. DJ Gabriel, occupational medicine specialist. Continuing on our conversation of burnout, Doc DJ, it's common to feel stress at work. For some people, a lot of stress, more so than others. What are the factors that can contribute to someone who is already in a stable job? What makes them feel burnt out? Is it the actual work that they're doing, or is it the people around them?
I think it's more of the combination of both. If you want to see kung sino ang burnt out, typically they will show, again, yung kanina natin dinescribe, is first yung exhaustion, yung feeling tired. 2 is yung negative feeling towards work, dragging themselves to work. Yung 3, yung productivity nila, nalilesen. Yan yung common na 3 na nakikita natin sa kanila. Bakit nagkakaroon ganon? Again, it's the combination. Sometimes, even if the work is hard, pero you have these workmates na gusto mong kasama, it makes the work easy for them. Vice versa, even if the work gives you good monetary compensation, and if you don't like it, you will drag yourself working. So I think it's more of the combination. And like what I've said is a phenomenon. It depends also on the individual, on how they adapt themselves to their workplace.
Dr. Paz, how does this affect the person, not just physically, mentally, but the relationships around them kapag umabot na sila sa point of burnt out?
They would be irritable. So people would not also like to talk to them because of all these negative vibes, right? They cannot also be dependent upon in terms of the work that they do because, again, decrease in productivity. The relationship, no, would also be affected.
Like what Dr. DJ mentioned, that some of the factors, such as the monetary compensation of their work, this is especially true, especially if they're breadwinners in the family. So how can you address this, Doc DJ? For those who are breadwinners of the family, maraming umaasa sa kanila, and this piles on pressure on them and work as well. How can they adapt to this kind of situation? How can they adapt to this pressure?
There should be self-awareness that they are being burnt out. That's number 1. 2, you should ask help when you realize na nababurn out ka. 3, sometimes yung mga workmates mo, ay mga mas matataas, you should recognize that you are having problems. Yung mga sinabi naman natin kanina, yung mga signs, mga symptoms na pwedeng i-show ng isang empleyado para ma-notice yan. And there are lots of ways. Yung mga, especially for us occupational physicians, we create this wellness specifically for them para hindi makarating tayo dito sa burnout. Marami tayong mga programs na ginagawa for them.
Maganda yan, Dr. DJ. And we'll talk more about what the workplace environment can do to prevent burnout later on in the show. But first, Dr. Paz, I'd like to ask, is there a high risk of self-harm if someone is burnt out?
So if you are burned out, no, you're in that stage, you're very vulnerable to certain triggers there. That's why in our work as psychologists, no, we look at it from the preventive measure. If possible, we don't go that far because burnout is prolonged stress. How much stress can we take? Stress is okay, it's natural, but only at a certain point. That's why we have such a thing as the positive stress. You stress because it motivates us, right? But if it's always there, it's chronic. It's not good for our mental and physical health.
What role does an employer play for a healthy workplace?
Very much. The employer has a responsibility sa mga empleyado nila to have a healthy workplace. That's why we have occupational physicians. Yan ang specialty namin, is to create an environment sa workplace na safe, happy. Stress, it's there, given yan. No? What's different sa burnout is you continue stress and the issues is not being resolved. Yun ang nangyayari. Like in our institution, we have this wellness, we have this physical like Zumba, we have counseling, we have even nutrition. Yan yung role ng company na binibigay sa amin, na binibigay natin sa mga empleyado.
But going back to academic side, sa mga bata, is the school responsible for that type of environment, Dr. Paz? For the parents who are listening there, does the school play a big role on creating that environment where there is less chance of being academically burnt out?
Because now we have the mental health law. So we have that in the school, no, and we have that in the workplace. So at least it's good that it's there, right? So in the school setting, it has been there because we have the guidance office. How important is the wellness of the students? So when we look into that, especially during this time when we had the pandemic transition, so we give information to the teachers as well, no, that we be extra considerate in terms of the mode of teaching. We have shifted to high flex. So the student may have a choice to go to school or to do it online. So these are the things that the school is also doing because again, no, the school should be a safe and secure place.
Dr. Paz, is it common for those who feel burnt out to actually recognize it and address it? Or yung mga loved ones around them, yung mga family members ang unang nakakapuna?
Kasi usually there's that denial that I can do it, I can manage it, right? That's why usually, no, when that happens, it's very important for that person to listen to significant others because family members would be the first to know if something is going on, if something is wrong, if this person is not consistent. So I guess it matters that a person who does not admit it should also listen to their significant others because it would mean that they care for him or for her, so they will tell this to him in an honest manner.
And I guess would that be true as well with co-workers telling that person that there's something different about them for the past weeks or months or so?
Correct, I agree. No? Especially yung mga kaklose nila sa work, they notice change in your behavior like presentism. You're there physically but mentally absent, your productivity lowers down, and sometimes the manager or the supervisor should notice this also. No, yan yung dapat pinapractice natin, yan yung mga tinetrain natin on how to detect yung mga subordinates mo that are being burned out already.
So again, recognizing the signs and symptoms of burnout can help you in the long run. So after the break, we will talk about measures, tips, and tricks that you can do to prevent burnout from even happening at all, which is the goal. So stay with us here on Med Talk, Health Talk. Now, what should we do when we find signs of burnout in our daily lives? Now, to help us know more about this, please welcome back to the show Dr. Maria Paz Manaligo, developmental psychologist from Miriam College, and Dr. DJ Gabriel, occupational medicine specialist from the Employee Health Service Department of Asian Hospital and Medical Center. Now, let's begin first with academic burnout. What can parents do to prevent academic burnout even from being an issue?
First of all, it's very important for the parents to support their child. No? So support comes in the way of how are you, what are you doing right now, and being positive to their child. Because sometimes the child would complain, schoolwork is so hard, so parents might say, okay, what is hard about it? Let's talk about it. Also looking into being aware of these things because they might see certain moods sa child nila, no? Like parang, I'm frustrated with my work, okay, what can I do to help? So I guess that's very important. It's the modeling. So sometimes if parents stressed out, burnout, the child feels it, no? So I guess parents should also be there to, in a way, no, teach their child that we can breathe in, breathe out, do these things. I guess that's very important. And if the parent might see that she can no longer help, maybe she seeks help, no, also from others, what we can do about it.
Now, how about if a parent already sees their child exhibiting signs ng burnout? What should they do?
The parent might say, what can I do to help you? Okay, so perhaps things also like, let's time out, look into like everyday things. What are the things that the child is happy doing? Maybe do more of it. And sometimes, unknowingly, parents would have certain expectations from the child. So it's good to talk about it, and the parent might say, you know, if you're feeling down, it's okay to take a break first. Come on, let's take a break. Let's go eat somewhere. Hopefully that could help, no? And parents can always ask someone, no, what they can do about these things. So maybe these are some of the things: listening, giving the support, just being there for them.
So that's very good advice. Now, Doc DJ, how about in the workplace naman? Does sticking it out in the workplace guarantee that sense of fulfillment and accomplishment that everyone wants at work?
When you're being able to, let's say, accomplish things, yes. But there are times na like you're bombarded with stress and you cannot longer cope up. Or even if you do yung mga unsuccessful managing yung stress and you get burned out. Question dun, when to quit or what do I do? What's next? Since yung burnt out is like occupational phenomenon, it's the work that is causing you this type of feeling that you're having. I think after doing yung mga management, self-management, or yung from the companies, you should reevaluate yourself if you really want this. And most probably, after exhausting all those efforts, you know that this is it. I'm no longer happy with this. I think it's time.
Letting go of something that is highly stressful, even if it's your job, it's your career, can actually help you health-wise in the long run.
Speaking of burnt out, because it's the work that is causing this, whatever you're feeling, yes.
Bago pa umabot sa point na yon, Dr. DJ, are there some activities that a person in the workforce can actually try and do by themselves muna to try and change their perspective, change their mentality, and hopefully not reach that point of burnout?
Yes, yung mga typical natin, sleep well. Usually, itong mga triggers na ito, lack of sleep. That's why you don't have energy. Talk to your friends. You should have a time out. Like, if you're not working, like weekend, stay away from the phone, stay away from the computer, like emails, because all you think is work. Your mind should be away from work. Yun yung mga initial steps na pwede natin gawin pag ganyan. Aside from eating healthy, doing exercise.
Oh yes, of course. So actual exercise can actually alleviate the stress, or even a few hours a day of physical activity. It doesn't have to be, like a gym membership, which could add stress sa mga gastos. Just regular physical exercise and eating well.
Yes, because you need to break the monotony from work, yung work.
It's the monotony that we're trying to address here. So breaking that monotony can actually put you in a better mental and physical state as well. Dr. Paz, do you have any tips or advice for parents or even students, especially trying to prevent burnout?
It's very important, no, that as early as now, like parents can teach this to their children, time management, self-care, because burnout is just looming there, no? We have stress every day. So the earlier we're able to manage it, we can take these skills to us later on in life, and we may use it in our jobs later. So prevention would be there, and I guess that's always the key.
And Dr. DJ, any advice, any tips, especially for those in the workforce to hopefully prevent burnout from happening?
Mga companies natin right now, gone are the days yung when you have a clinic in the workplace na pupunta ka lang pag may sakit. Now, the trend ngayon, ang ginagawa natin, pinupush natin ngayon is the wellness, general wellness. So, we have programs that we create for the employees to prevent yung mga burnouts.
So gone are the days na talking to a professional regarding their mental health is seen as a negative, that there's a mental illness. A lot of companies have this established already that you can talk to someone regarding the stresses that they face every day in their work.
We have the law, the mental health bill. Every company should provide that. Yung stigma na yan is no longer being seen like that. Tsaka we notice kasi ngayon yung mga kabataan talagang marami tayong cases ngayon. And yung company should provide a medium or a venue para ma-vent out itong mga problems na to.
So no one has to feel this feeling of helplessness at work or at school, this feeling of they're going nowhere alone. There's always someone there to be able to talk to be able to help them go through this rough patch. So thank you very much, Dr. Paz. Thank you so much, Dr. DJ, for joining us and sharing your information and your expertise to our viewers. Another tip from me, make time for yourself, carve it out of your schedule, and honor it. It'll do a lot for your mental well-being as well as your physical well-being. I'm Dr. Freddy Gomez, and thank you for joining us here on MedTalk Health Talk.